वेलकम टू स्पेशल एजुकेशन विद हामिद नकवी। आज से हम MCQs का एक नया सिलसिला शुरू कर रहे हैं मेंटल रिटार्डेड कैटेगरी के लिए, और ये उस सिलसिले का पहला पार्ट है। आइए हम शुरू करते हैं। Two major characteristics of mental retardations are limitations in intellectual functioning and low IQ, limitations in adaptive behavior, speech and language limitations, or behavior disorders. The answer is limitations in adaptive behavior. Next question, ji. People with mental retardation have significant limitation in adaptive behavior as expressed in conceptual and practical adaptive skills. Behavior, intellectual, social, or vocational. The answer is social. Next question. Adaptive behavior scales require the evaluator to rely on information provided by an individual who is familiar with the students. Medical history, daily activities, intellect, or behavior. The answer is daily activities. Next question is the mental ability to recall information that has been stored for a few seconds to a few hours. Long-term memory, working memory, temporary memory, or short-term memory. The answer is short-term memory. Next question. A problem-solving style in which students distrust their own solutions and depend on others to guide them is called outer directedness, inner directedness, conflict resolution, problem-based learning. The answer is outer directedness. Next question is significantly sub-average general intellectual functioning existing concurrently with deficits in adaptive behavior and manifested during the developmental period that adversely affects a child's educational performance is a definition of which of the following? Learning disabilities, dyslexia, anxiety disorder, or mental retardation? The answer is mental retardation. Next question is sports or services, resources, and personal assistance for enabling a person to do which of the following? Develop, learn, and live effectively, increase academic achievement, plan for transition, develop self-advocacy. This is self-advocacy. Answer is develop, learn, and live effectively. Next question is refers to acting as the primary causal agent in one's life and making choices and decisions regarding one's quality of life free from undue external influences. Advocacy, self-monitoring, problem solving, or self-determination? The answer is self-determination. Next question. There are two categories of mental retardation, those that refer to timing and those that refer to symptoms, type, medical history, or environment. Correct answer is type. Next question. Causes by timing include prenatal, and postnatal, perinatal, pronatal, perinatal, and perinatal. Correct answer is perinatal. Next question. Causes by type include which of the following? Biomedical factors, social factors, behavioral factors, or all of these? Answer is all of these. The majority of individuals who have mental retardation experience adverse influences related to social dash and educational factors. Behavioral, intellectual, biomedical, or vocational. The correct answer is behavioral. Next question is the evaluation process for mental retardation includes dash screening and the idea non-discriminatory evaluation process. Testing, medical reports, observation, or psychotherapy. Correct answer is observation. Next question is to date dash states require educators to evaluate students' adaptive behavior when classifying student as having mental retardation. All, no, 25 or 49. The answer is 49. Next question. The educational classification symptom for mental retardation has 3 levels. Dash mental retardation, trainable mental retardation, and severely multiply handicapped. Mild, profound, educable, or moderate. Correct answer is educable. Next question. The AAMR classification symptom for mental retardation has 4 levels. 4 levels. Mild, moderate, severe, and dash. Educable, profound, trainable, or multiple. The correct answer is profound. Next, transition planning requires IEP-based partnership among the students, dash, educators, and adult support providers, parents, administrators, doctors, or therapists. Parents, administrator, doctors, or therapists. Correct answer is parents. Next question is the student is at the center of transition planning because IDEA requires the IEP team to take into account the student's needs, preferences, and dash IQ, interests, strengths, or weaknesses. Correct answer is interests. Next question is providing individualized instruction to groups of students with or without disabilities, facilitating friendship among students with or without disabilities, supporting peer tutors using state-of-the-art technology, and the teaching in community settings are appropriate partnership roles for which of the following? Parents, counselors, professionals, or teachers? Correct answer is para professionals. Para professionals. Next question is testing accommodation for students with mental retardations may include which of the following? Dictating responses to a scribe, extending time to complete an assessment, having test items read to them, all of these. Answer is all of these. Next question is dash is a developmental disability that significantly affects a students' verbal or non-verbal communication, social interaction, and educational performance. Autism, mental retardation, speech language impairment, or learning disability. The correct answer is autism. Next question is autism is generally evident before age 3 and is manifested when the child engage in dash, resists environmental change, and displays unusual response to sensory experiences. Academic activities, poor behavior, repetitive activities and stereotype movements, or social activities. Correct answer is repetitive activities and stereotype movements. Next question is autistic disorder, Rett's disorder, childhood disintegrative disorder, Asperger's disorder, and pervasive developmental disorders are sometimes referred to as which of the following? Autism, autism spectrum disorder, stereotype, or mental retardation. Correct answer is autism spectrum disorder. Next question, Ji. The term dash describes individuals with significant challenges in social and emotional functioning but without significant delays in language development or intellectual functioning. Autistic disorder, childhood disintegrative disorder, Rett's disorder, or Asperger's syndrome. Correct answer is Asperger's syndrome. Next, a typical language development, a typical social development, repetitive behavior, problem behavior, the need for environmental predictability, sensory and movement disorders, and differences in intellectual functioning are characteristics of which of the following? Autism, mental retardation, emotional or behavior disorders, or learning disabilities. Correct answer is autism. Students with autism usually have a number of language impairments. Two common language impairments are delayed language and dash what? Fluency, echolalia, articulation, or dyslexia. Correct answer is echolalia. Next question is students with autism may have which of the following characteristics of communication? Attention focused on one topic only, use of limited gestures to supplement verbal skills, lack of eye contact, all of these. Correct answer is all of these. Next question is impaired use of non-verbal behavior, lack of peer relationship, failure to spontaneously share enjoyment, interest and achievements with others, and lack of reciprocity are characteristics of which of the following? Speech language impairment, emotional disorders, articular social development, or behavior problems. Correct answer is atypical social development. Obsessions, tics, and perseverations are characteristics of which of the following? Repetitive behavior, speech language impairment, emotional disorder, atypical social development. Answer is repetitive behavior. Next question is categories of problems behavior in students with autism include which of the following? Self-injurious behavior, aggression, tantrums, all of these. Answer is all of these. Next question is between 42 and 88% of children and youth with autism and Asperger's syndrome have sensory and movement disorders. Two characteristics of this under or over responsiveness to sensory stimuli. The more common one is which of the following? Under responsiveness, over responsiveness, both, neither is more common. And the correct answer is over responsiveness. Abnormal posture, abnormal movements of the face, hand, trunk, and limbs. Abnormal eye movements, repeated gestures and mannerism, and awkward gait are characteristics of which of the following? Sensory disorders, behavior disorders, movement disorder, or intellectual disorder. Correct answer is movement disorders. And stay blessed, gentlemen. Best of luck. This was part one, and soon you will have part two, part three, and other parts. God bless you.